This is a very new topic.
I think bringing everyone together is very important.
I think the whole varied program is very interesting.
There's a lot of individualized thinking behind, and that's why it's specifically very important to exchange these ideas.
And I'd like to welcome all of you to this second Global Left Atrial Appendage Occlusion Summit.
There is increasing experience of left atrial appendage occlusion, and those who are practicing the implants of these devices need to talk, not only between themselves, but also with general cardiologists and with other specialists, in order that we can fully understand the proper place for the use of devices of this kind.
It is not easy to decide which patient should be referred for this procedure, and I think we have to exchange our ideas, our experience, because this is not a field where you have thousands of patients in randomized trials and everything is clear and fixed.
I think if it promotes discussion between colleagues, then I think that's a good thing. But also if it makes people look at things in a slightly different way, I think it's crucial.
The main topics are quite broad. It goes all around left atrial appendage, its potential to cause stroke, and how you can mechanically treat that rather than with drugs.
Like the anatomy, we also look at different evidence concerning newer medication that is available for the treatment of atrial fibrillation.
I think the whole varied program is very interesting, which is not concentrating purely on the implantation of the devices and the complications associated with it, but looks at the whole area of thromboembolic events.
Well, you could argue that anybody, all professions should come. So from people that image the heart, people that are associated with stroke.
And this is, I think, a very important aspect here, we have physicians involved who treat patients with atrial fibrillation from other organs, like neurologists. We have gastroenterologists here. They see the bleeding under anticoagulation, and they can start the process of choosing alternative therapy. So it brings a wide range of different subgroups of medicine together.
Just listening to the languages spoken when we're having coffee now, they come from a wide variety of countries, I think.
To all, have a good and safe trip home. Thank you.
The most interesting part was to discuss future studies. The part of the anatomy, with the whole anatomy of the left atrium, was very good. No, it's been a good meeting.
I think the discussions were as important and as long as the presentations, which shows the status of this field.
This meeting gave an excellent overview. I hope we will have in the meantime also some hands-on experience with these kind of devices. We are looking forward to it.
We are doing now the second summit. We are looking forward to do a third summit.
And I strongly encourage people who would like to meet with other experts in this area to think about attending the summit meeting in 2013.